It's World Mental Health Day, and this year the World Health Organization, or WHO, is drawing focus on the universal right to good mental health. But what exactly does that entail? It means each and every one of us has the right to not only good quality care, but to be protected from mental health risks. It also includes the right to be independent, yet included in the community. Ultimately, it is the right to have the highest attainable standard of mental health. As of 2019, the World Health Organization reported nearly 1 billion people around the world are currently living with a mental health condition. That's about 1 in 8. Now, 4 years later, experts estimate that figure to be much higher amid recent global stresses. These include the COVID-19 pandemic, the Russia-Ukraine conflict, and the ongoing climate crisis. But there has been increasing awareness of the issue, from A-list Hollywood stars becoming mental health advocates to politicians making it a campaign. Even on social media platforms such as TikTok, mental health wellness content has become popular. More conversations, though, does not always mean enough action. The WHO says mental disorders have remained among the top 10 leading causes of disease burden worldwide in more than a decade. The two most common are anxiety disorders and depressive disorders. Mental disorders are common everywhere, occurring in all WHO regions. Its prevalence ranging from 15.6% in the Americas to just over 10% in Africa. Here in Southeast Asia, it is about 13.2%. Despite its prevalence around the world, there are still many gaps to be filled. Among them, insufficient research, inadequate policies, scant spending, and poor treatment coverage. The theme of this year's World Mental Health Day is Our Minds, Our Rights. I spoke with Dr. Andrea Bruni, Regional Advisor of Mental Health from the World Health Organization, and he helped us understand what it entails, as well as what else needs to be done in this region.
The World Mental Health Day is an important opportunity for people to discuss about mental health. And this year, we talk about mental health as a universal human right. Good mental health is vital to our overall health and well-being in general. And everyone has the right to enjoy the highest attainable standards of mental health. Yet, all over the world, and also in the Southeast Asia region, people with mental health conditions, unfortunately, continue to experience a wide range of human rights violations, and many people are excluded from community and from society. So having a mental health condition should never be a reason to deprive a person from their human rights and to exclude them from the participation to society. WHO Southeast Asia region, in close collaboration with member states, continues to ensure that mental health is valued, promoted, and protected.
And Southeast Asia is a diverse region. How would you assess how mental health is perceived and is it changing?
Thank you, Steve. Yes, unfortunately, stigma is widespread in the region, and stigma is very often attached not only to mental health conditions, but also neurological conditions and substance use disorders. And very often, stigma translates into discrimination of people suffering from these conditions. Stigma is particularly pronounced for people with severe mental health conditions, and evidence shows that people with severe mental conditions tend to die between 10 and 20 years earlier than the general population, and this is also due to lack of an insufficient access to health services, including for general health services such as non-communicable diseases. Another common myth, which is widespread in the region, is that people with mental health conditions need to receive treatment, care, and support by psychiatric institutions, psychiatric hospitals, asylums. The fact is different. The fact is that people with mental health conditions need to access services which are based in the community, which are more accessible and better respect human rights of people. Things are changing. Slowly, things are changing, also through the active engagement and empowerment of people with lived experience and caregivers that should be an integral and fundamental actor in designing policies and services for mental health.
Clearly, there's a long way to go for mental health advocacy here in Southeast Asia. What do you see as the main challenges when it comes to dealing with it?
Well, first of all, mental conditions are highly prevalent. We estimate that in the Southeast Asia region, approximately 260 million people live with a mental health condition. This means 1 in 7 in this region live with a mental health condition. This is a main challenge. On the other hand, the treatment gap is huge. In some countries, the treatment gap is as high as 90%, meaning that up to 90% of those that have needs in mental health are not receiving appropriate, timely treatment and care, or are not receiving treatment and care at all. Also, the prevalence of self-harm and alcohol use and drug use show concerning trends. And importantly, mental disorders are also becoming significant among young people. And this is also related to eco-anxiety that is adding to this burden. Finally, an important point is that despite multiple studies on high return on investment for mental health, there is still a mismatch in terms of investment in mental health services. It's important to invest more resources in mental health.
I want to come back to resources in just a moment, but I want to touch on something else you said when you mentioned the youth and young people. There have been studies in the US linking social media to anxiety and depression, especially among young people. Are you seeing that play out across Southeast Asia as well?
So there's definitely an increase, including after COVID-19, an increase in terms of anxiety and depression, also among youth and adolescents. Social media and media in general can play a very positive role, but also a negative one. So this is true for many areas in mental health, depression, anxiety, and also a related topic, which is suicide prevention. We know that it's very important for media to report responsibly. In this sense, WHO has some guidelines for responsible reporting and engaging with media on suicide prevention. So it's a double-edged role that media can play, including social media.
And could you elaborate then on what you were talking about with the WHO and its guidelines? So what is the WHO doing to expand mental health services in the region?
So, well, last year in September at the WHO Regional Committee, member states adopted the PARO Declaration on Universal Access to People-Centered Mental Health Care and Services. PARO Declaration marks a bold statement of commitment and intent by member states, and is also very much aligned with how the region aims to build back better from the COVID-19 pandemic. PARO Declaration represents a new foundation to reform mental health systems and services in the region with a strong focus on communities. Also, member states committed to increase investment in mental health. More recently, last month, WHO CIARO released the new WHO Southeast Asia Region Action Plan for Mental Health 2023-2030. The main areas for intervention in the CIARO plan include to strengthen leadership and governance for mental health, to provide mental health and social care services in the community, to implement strategies for promotion and prevention, including prevention of suicide, and to strengthen information systems, evidence, and research for mental health.
And when it comes to the policies to be implemented, what would you say would be the main recommendation you would make to governments to safeguard its citizens?
Well, the first one would be to invert trend from psychiatric institutions to community networks. Traditionally, most of the investment of human and financial resources in mental health has been directed towards tertiary facilities, psychiatric hospitals, asylums. We know that these facilities not only do not have the capacity to bridge the treatment gap in mental health, but very often, unfortunately, are associated with violations, including severe violations of human rights. It's important to invert this trend and invest for strengthening and expanding mental health networks in the communities. And another recommendation would be to mainstream mental health in all policies. Most of the determinants of mental health lie outside the health sector. The economic, social, educational, development, and social sector, as well as civil society, have a pivotal role to play. And also importantly, climate change. It's very important to mainstream mental health and psychosocial support in climate change.
And we've covered an awful lot of ground, from the theme of World Mental Health Day to the challenges in the region, to what the WHO is doing, and some policy recommendations as well. What would be your parting message to our viewers that are watching when it comes to mental health?
So we have been talking about the prevalence of conditions. We know that these are very common conditions, and that the morbidity associated to these conditions is high. But we haven't spoken about mortality. We estimated that in the region, approximately 200,000 people die because of suicide every year. And we know that suicide is the leading cause of premature mortality among young people in many countries. This is a serious public health challenge. We need to work on it because we know that suicides are preventable, but preventing them is no easy task. And there are some very concrete and challenging interventions that member states can take. One is to limit access to the means of suicide. And in this region, we know that the most important mean is pesticides. So we need to regulate, limit, and ban access to pesticides. The second is to interact with media, speaking about media, for responsible reporting of suicide. Thirdly, it's important to foster social-emotional life skills of youth and adolescents. And lastly, early identification, assessment, management, and follow-up of those who are affected.
Dr. Bruni, thank you for your time and for your insight and speaking to me today. Dr. Andrea Bruni, Regional Advisor for Mental Health in Southeast Asia for the World Health Organization.